Good afternoon and thank you for joining us. My name is Tina T-Bone. I will be your moderator for today's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we are reporting 0 cases of COVID-19. We now have 8 active cases remaining in Nova Scotia. I'm so proud of this province and all of you. Thank you. Thank you for your cooperation. I told you Wednesday, Dr. Strang and I would have some good conversations about lifting restrictions. The science is good, and Dr. Strang will have more to say on it. But your commitment to following the protocols reassures us that by opening up a little more, we should be okay. Effective Monday, we are allowing larger gatherings, 100 inside and 150 outside, but you still have to stay in your group of 10. Find your pod. If you are at an event, you will have restricted hours, the same as restaurants and bars. Service ends at 10, and everyone must be out by 11. This will allow people to watch their kids play sports. Cubs, Guides, and other clubs can now gather. And Dr. Strang will have more details. But I want to say, this is a test for all of us. We're keeping our cases down, but the moment that we see a shift or a surge, a change in the number of cases, we will not hesitate to bring back restrictions. It really is up to all of us. COVID has had such a large impact on all of our lives, but especially women. 51% of our population. The first wave, when the economy shut down, women were disproportionately affected. That is, they not only lost their jobs, but they had a very hard time getting back into the workforce, let alone finding a well-paying job. We need women to be active members of our economy. We need women to drive our economy, and we need women in business and in the tech sector, and we need women entrepreneurs. Today, I am so proud to announce that our government will be making a $5 million investment in Sandpiper Ventures, the first all-female venture capital fund in Canada. It was established here in Nova Scotia by a number of women business leaders and entrepreneurs who want to help women access capital. Currently, only about 2% of angel investors in Canada are women, and we want to see that number grow, and we want more women entrepreneurs. If our daughters have an idea, they should be able to access capital in the same way as our sons. This fund will help women take their innovative ideas to market. It will also help have a development component to help women entrepreneurs. It is my hope that this investment will leverage other public and private monies to help more women access capital and create jobs and grow our economy right here at home. When we come out of COVID, we will be in a position to kickstart our economy, and we will need everyone to be part of that kickstart, and I am so proud to be able to be part of a government that is investing in this venture capital company being led by women. Dr. Strang.
Thank you, Premier, and good afternoon, everybody. We are yet again reporting no new cases today. This is good news. It has been a good week for our case numbers. However, I know that COVID-19 prevention fatigue is real, but we need to recognize and understand that the feeling of how tired we are and how long this is going on, but we cannot afford to relax or become complacent, simply because what we have been doing for almost a year is working. This is a pandemic. However, it will end, but we do have a way to go yet. And so we need to continue to keep ourselves, our communities, and each other safe. Asymptomatic testing continues to play a key role in how we keep COVID-19 under control and out of our communities, along with all our other public health measures and our vaccine program that is starting to roll out. So I continue to encourage Nova Scotians to consider making COVID-19 testing part of their ongoing COVID protocol, especially if they are someone with a high number of contacts through either their work and/or their social circles. Public health mobile units for testing will be offering community-based testing in Pictou this weekend at the Royal Canadian Legion Branch 16. So thank you to my public health colleagues. And I look forward to having lots of people in that area of the province come out and be tested. If you're interested, appointments can be booked by going onto the 811 website and doing the self-assessment, or if you don't have web access, calling 811. And I want to, the mobile units were down in Lunenburg yesterday and today, and I want to thank everybody who came out for testing in that part of the province. To our university students, Reading Week is only weeks away. If you're considering travel plans, I ask that you stay in the province during this time. If you leave Nova Scotia and travel anywhere except PEI and Newfoundland and Labrador, you must quarantine for 14 days upon returning to Nova Scotia. And if you do have to quarantine, you should also get tested, even if you don't have symptoms. And the best time to get a test would be on day 6, 7, or 8 of your quarantine, just like we did when people came back after Christmas. I know for the students that it might be difficult for you to stay put this year within the province, but in doing so, you will be doing your part in keeping our overall numbers low and keeping your friends, your fellow students, and our communities safe. As the Premier referenced, next week, starting at 12:01 a.m., Monday, February 8th, we will be cautiously loosening some restrictions. So again, these come into effect, technically it is 12:01, February 8th, and they will stay into effect until 11:59 p.m. on March the 7th. But as the Premier said, if our epidemiology starts to look not so good, we will rapidly make the changes that are necessary. But the loosening of restrictions that are coming into effect are retail businesses will be able to operate at 75% of their total capacity. That's up from 50%. Fitness facilities will be able to operate at 75%, up from 50% of their overall capacity, and they must continue to maintain 3 meters of space between people who are doing high-intensity activities, and this is both for indoors and outdoors fitness activities. Recognized businesses and organizations can once again hold events with a maximum of 150 people outdoors, or 50% of a venue's capacity to a maximum of 100 people indoors. Any such events must stop food or beverage service by 10 o'clock p.m., and they will have to be closed and people leaving by 11 p.m. And these types of gatherings include social events, arts, theater, and cultural events, sports and recreational events, special events, festivals, faith gatherings, weddings with receptions, and funerals with visitations and receptions. They also include common activities that we hear a lot about, such as bingo, darts, other types of activities that are hosted by both licensed and unlicensed establishments. The gathering limits also apply to meetings and training events hosted by private business or organizations, provincial and municipal governments, first responder organizations, mental health and addiction support groups, and organized clubs such as 4-H, Scouts, etc. And these last category, these organized clubs can host activities for all ages, and they should follow the day camp guidelines to have within their overall number, they can have cohorts of up to 15, which is what we allow for our day camps within their, if it makes sense within whatever activity are happening within these clubs, following those day camp guidelines, whether it's indoors or outdoors. And those can be found at our coronavirus website if you look under day camp guidelines. Spectators will be allowed at events including sports, games, and practices, and arts, theater, cultural rehearsals, and performances, except when they are held at one of our public schools. Large facilities that already have approved plans can resume hosting events with multiple groups of up to 100 that are and each of these groups, as in the approved plans, has to be kept what I call apart from each other from entry to exit to using the concession and the washrooms. And the large facilities already have these plans. You can resume those plans that you had in the fall. Centre 200 in Sydney and Scotiabank Centre in Halifax, because of their size, are allowed to have groups of up to 150, not the 100 that everybody else has. We are not allowing, we're not making changes to our school restrictions, and so we're not allowing audiences, spectators within our school environments. And that's simply because keeping the number of people in our schools low has been an important part of our success in keeping our schools COVID safe. Therefore, we have to maintain the restriction that non-essential adults cannot be allowed into our schools at this time. And again, this includes spectators for practices, games, rehearsals, or performances. If a school is holding a practice, game, rehearsal, or performance at an outside facility, such as a municipal or privately owned building, then the spectators, of course, will follow the provincial gathering limit for that facility. We're also keeping the restriction that limits sports teams and individual competitions to only playing and competing with other teams and people who they would normally play or compete with. The general gathering limit remains at 10. So this applies to household and informal gatherings and events that are not hosted by a recognized business or organization. And there is no change to hours for restaurants and licensed establishments. They must stop service at 10 p.m. and close at 11 p.m. There will be no exceptions to close later when there are special sports events such as the Super Bowl. These hours, as I said, these hours also apply to all other types of gatherings that are hosted by recognized businesses and organizations as appropriate. I think it's important to emphasize that the reason we are loosening restrictions more so in some areas than others is based on our epidemiology and an understanding of the risk of transmitting the virus that causes COVID-19. Evidence tells us that late-night social gatherings where alcohol and other substances may be involved present much higher risks than a youth club or a business meeting. That is why we can open up many types of gatherings, but not all. It's also important that people remember and follow the gathering limits of up to 10 and all the other COVID protocols when they plan their private social activities. So large parties, whether public or private, put us all at risk in the middle of the pandemic. We have maintained a slow and cautious approach and will continue to do so in order to protect one another. As I end, I'd like to make a request on behalf of delivery services who have very strict protocols in place to ensure physical distancing and masking by their staff and their employees. But I'm hearing from them that many people, when they're accepting a delivery, whether it's food from a courier, from an online purchase, or mail deliveries, that many people are forgetting to put a mask on when they answer the door. So my ask to Nova Scotians that if there is a delivery being made at your home or in your apartment, please put on a mask when you answer the door. This quick and easy step will bring a peace of mind to those people working to bring goods to you and will help keep both of you safe. And so as we head into the next week and start to be more social again with events, I have to remind everybody the importance for all of us to continue all our layers of protection, to keep to our gathering limits, washing our hands, wearing your masks where necessary, physical distancing, staying home when you're sick, and now considering getting tested, especially if you have a high number of contacts. This includes anyone planning to get together to watch the Super Bowl this weekend. I know that's a big event for lots of families. But gathering limits have to remain at 10, and that if you need to be reminded on all the other steps about safely hosting an event like this or a gathering, I ask people again to look at our COVID webpage, and where we've given already overviews on information for holidays and celebrations during this pandemic. We just cannot become complacent. All of our hard work continues to be reflected in our case numbers, but we need to continue this. So please don't let up, but have a great and safe weekend. Premier.
Thank you, Dr. Strang. Tina?
Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time we have for today's briefing. We'll start with Jean Laroche from CBC. Go ahead, Jean.
Nope, sorry about that. Give me 2 seconds here. All right. Dr. Strang, our infection rates are arguably the envy of every other province in the country. Given that, why do you feel we need to continue to restrict normal activities the way we have when other provinces in other areas are less restrictive than we are? If it's really the epidemiology that's driving your decisions, how come some provinces allow some things, others don't, and we are where we are?
So I can't speak for other provinces, but what I can speak to is how our approach of being very cautious and slow, fast to act when we need to tighten things down, and slow to loosen them up. Look at our numbers. It works. Other provinces, they haven't had the same ability to control COVID. We also have to look at our neighbor New Brunswick about how quickly things can change. So if you look at all the evidence, reviews of what works to control COVID, and everybody is saying that when you start to loosen restrictions, you have to do it very slowly and carefully. Even though we're doing lots of asymptomatic testing and no positives, all our cases are for travel related. Or other kinds of close contacts, there is still a risk of COVID being brought in here. We necessarily have people coming into the province, and so there's lots of COVID all around us, and then we have to be extra careful now because of the challenge of the variant, and if that gets a hold and starts to spread. So I get that people look around and say, well, we're very safe in Nova Scotia, but again, we got reminding people, how did we get to be safe? And we have to continue to do those things. The restrictions we put in place are for a month, and we'll be reviewing that. And if we're still in this good place a month from now, we may be able to be a little even further less restricted. But we have to do it slowly, cautiously, taking one step at a time, and then taking the time in between to make sure what has been the impact of the loosening restrictions. As the Premier said, we're giving people more opportunities to be social, but that increases the opportunity for COVID to spread. So in many ways, whether we can be even less restricted depends on how we respond in the next month.
Go ahead, John, with your follow-up.
Right. Given what you've just said, Dr. Strang, how do you gauge whether we as a province have struck the right balance between the restrictions we're imposing on the one hand and personal liberties and the needs of businesses to survive on the other?
So, first of all, we look at our numbers. Are we getting the right control over COVID? Myself and colleagues in government, we have lots of conversations every week with the business community, with the sports community, with the cultural community, and we listen to them and what they're looking for. And I go by the mantra that I try to allow things if it's safe to do so. So we're always trying to be have the fewest restrictions necessary to achieve the right level of safety over COVID. And so there is no textbook to do this. So part of it, I think our success has been we've had a strong collaboration with all these different sectors in our communities and our economy to actually work together to find that balance. And once we find it, we don't stay there. It's always a balance that we need to continue to, go one side or the other and continue to look at, to ask the question that you've just asked me, do we have the balance right?
Part of our success, quite frankly, has been that we've been in this together, and that every decision that we've made has been focused on the entire population, and it's been received by all Nova Scotians with that in mind. Not an individual Nova Scotian, not about anyone's personal liberty. It's been about how do we keep the health and safety of Nova Scotians in the forefront. And those entrepreneurs you're referring to have really been very supportive of ensuring that we control this virus. We've said from the very beginning, without good public health, there is no economic health. And those businesses that have had to close down done so, may not like it, but they've done so, recognize it's in the best interest of the province. And they've made it very clear to us, as you open us out, as you open up again, do it slowly, so we're not in a position to be closed again. And that's exactly what we're trying to do to work with everyone across the province.
Next, we'll go with Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, for Dr. Strang. You mentioned, I think it was about a week ago, that there was uncertainty around supply of vaccine. I'm wondering, in the course of time, since news moves so quickly, whether there's any clarity to that uncertainty, and especially with news that there may well be some vaccines, newer vaccines, on the way in short order.
So we don't have any certainty of those new vaccines, and none of them have yet to be approved by Health Canada. We get kind of confident assurances of our vaccine supply every 2 weeks. So we know what we're getting for the next 2 weeks. Beyond that, we're told that we can expect increasing amounts of vaccine, but again, no guarantees on that. So it is one of the challenges that we don't have certainty or long-term certainty of ongoing robust supply, and that we have to plan, with every 2 weeks, but also we plan our program so we can scale up and scale down. I was talking to the team today, and if we start to get more vaccine like we're hoping to in the next few weeks, we can rapidly ramp up our program and to deliver that vaccine into people's arms in a very timely manner.
Go ahead, Keith, with your follow-up.
This is for the Premier. I'm sure you're all too well aware that obviously they're choosing a new leader. Your party is a new leader and a person who will be the new Premier on tomorrow. So this is one of the last times you'll be appearing with Dr. Strang, although my understanding is that you may well do one or two more. What are you doing to ensure that there's some continuity between the new person and Dr. Strang? Is there anything that you're going to put in place that will make that transition easier for your successor?
Yeah, so as you know, the party will choose a new leader this Saturday. There will be a transition, part of that, transitioning not only on this particular file, but a number of other files as they put together their cabinet and we brief them on what's happening and what we'll be handing over. And part of that will be with COVID and connecting them with Dr. Strang and Public Health. And quite frankly, laying out what we believe has worked, the process that has worked, and Dr. Strang and his team then will brief them on the epidemiology and the process as we go forward, and then when they're sworn in, they will take over here.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I'm wondering why we extended the state of emergency if we are starting to lift some restrictions. Can you explain that?
Sure. The state of emergency, some of the restrictions that you're seeing here related to public health, the state of emergency is dealing with other aspects of our economy. For example, where we dealing with rents. All of that is in the state of emergency piece, and we've extended it and we'll continue to extend it until the new Premier is sworn in, and then they will have to make a decision on that, on what they want to do from there.
Go ahead, Natasha, with your follow-up.
Thank you. Testing numbers all week were pretty low. I know today was about 1,600 tests that were processed yesterday, but we had 3 other days this week where there was well below 1,000 tests processed by Public Health. You spoke a little bit about asymptomatic testing. Why is it so important that Nova Scotians get out and get tested?
Simply because the testing people who don't have symptoms is a critical part of how we keep looking for the virus. It's why we're going out with our mobile unit down along the South Shore yesterday and today. We're going to Pictou on the weekend. We continue to have pop-ups. I'm continuing to message, and we're doing our communications in other ways to get Nova Scotians to take advantage of the asymptomatic testing. By having lots of people tested, and we actually want everybody to be negative, but we're out there looking for it, and so if we do start to see some positives coming from that, we can respond very quickly with increased testing in a certain community, perhaps looking at what we may need to increase public health measures. But it allows us, I use the phrase, it keeps us well ahead of the virus by testing lots of people, even if they may have a low chance of actually being positive because they don't have symptoms.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Sorry about that. Thank you. This question, I guess, kind of relates to that comment about, the vaccine supply being updated every 2 weeks, and then there's kind of no guarantees beyond that. I'm just wondering, with that no long-term certainty, if the Premier gathered any more information from the First Minister's meeting yesterday, if we can have a little more faith in the supply chain. We heard, I guess, earlier this week talking about the doses arriving, but we don't know what's coming beyond the 2 weeks. How can we really plan accordingly?
So one of the things the federal government said at the very beginning, they were talking about first quarter, second quarter, third quarter, and fourth quarter of the year. They would say they would start coming in weekly, but it really was an allotment for the first quarter. They continue to say that they believe they can achieve the 6 million doses that were committed in the first quarter. We as a government and working with public health have the responsibility to distribute that vaccine when it arrives here. So what we're going to continue to focus on is the issue of how do we make sure that we have multiple ways of delivering that vaccine into the arms of Nova Scotians. And as Dr. Strang said, once we catch up on the vaccines that have been coming in, we'll be able to deliver them very quickly. I think there's a lesson for the country here in this pandemic, and that is, we need to continue to build our domestic supply of being able to create vaccines. Dr. Strang has talked about the annual ones that we see. We as a country used to be able to do that. There's no reason that we can't continue to do that. And I was pleased to hear the federal government talk about the announcement in Quebec. Even though that vaccine will not arrive here or will be available until September, late in the year, it's still moving in the right direction and sending the right signal, because we don't know what will happen a year from now, 2 years from now, when it comes to requiring the vaccine again. Will this become an annual flu shot? Will it be one that we need every 2 years, as Dr. Strang has said? That's why we need to continue to focus on the domestic supply of creating vaccine, as well as making our own PPE. There's no reason this country shouldn't be making its own PPE distributed across the country. We've seen what happened early on. Stanfield's was a big part, and still is, of ensuring that PPE is here for Canadians, but it also gives us an opportunity to become an exporter of this product. So I think lessons learned as we go through this, and preparing ourselves for what seems to be more of a normal thing, these viruses that are here. It wasn't all that long ago, H1N1, and now we're here with this one, which is more deadly. So, I was encouraged by the conversation with the Prime Minister last night, but like everyone, we'll wait for the supply to get here.
Go ahead with your follow-up, Jesse.
Thank you. I'm just wondering what areas you guys will be monitoring closely with these restrictions. Is it just based on the number of cases? Say that pop up. If we go back, I just wonder, what the cost is of opening and then shutting down again, if it's not worth just sticking to tighter restrictions all the time.
So that's exactly why we open up slowly and carefully. Because our goal is, once we open something up, is to keep it open. And so we do that. We open up cautiously, but some of that also depends about how people respond and what do they take on their own responsibilities about keeping each other safe while we give them more opportunities, especially around social activities. We'll continue to monitor all the different components of the epidemiology and what the things that we look at for, especially monitor things that would indicate perhaps we're getting local spread. We also have a compliance, various inspection teams within government who do compliance checks on a range of businesses, and we also work with local police around their enforcement and compliance as well, and to monitor that that people and businesses are sticking with what's required.
Next, we'll go to Maude Matambo, Radio-Canada. Go ahead, Maude.
Oui, bonjour. I would like to know how discussions are going with other provinces regarding the return of the Atlantic bubble, and what can people expect for the next days and weeks.
So there's been no conversation about opening up the Atlantic bubble. Of course, we have restrictions with New Brunswick. We're watching that with their epidemiology and through their public health officials and ours. Premier Higgs was on the call last night. I've been texting back and forth with him and our colleagues. But at this point, their focus is solely on ensuring that they can reduce those numbers in New Brunswick, and we will have to see those go down a bit. As you know, there's still Newfoundland and Labradorians and Islanders are able to come in and out of our province with as they were before. But we'll have to see a change in the cases in New Brunswick before it would actually go back to the Atlantic bubble model.
Go ahead with your follow-up, Maude.
Dr. Strang said that the best strategy is to lift restrictions very slowly. Could you open the bubble like one province at a time, then 2, then 3, then 4?
So what's happening right now in this province, you can come in from Newfoundland without being quarantined, the same as Prince Edward Island. It's the opposite when we go back. If the Newfoundlander comes here, when they go home, they have to quarantine in their home province. Our restrictions right now are with New Brunswick, and we'll continue to watch those. As you know, we're the home of the regional children's hospital, large tertiary care hospital. In the first wave, we reduced our capacity by 30%. We're really on a focus of making sure that we not only keep this virus at bay, but quite frankly, ensure that those citizens in Atlantic Canada who require healthcare services can get them and do that as safely as possible.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, the federal government reported yesterday that Canada will be getting fewer Moderna shots this week. Will that affect deliveries to Nova Scotia?
Yeah, we had a reduction this week. We were anticipated it was 5,500, which was reduced down to 4,000 doses that's gone out. So yeah, we had less Moderna vaccine this week, so we had to adjust our vaccine schedule. And but we fully expect that we keep being reassured that 15,000 doses will be made up in the weeks to come.
Go ahead with your follow-up, John.
This is again for Dr. Strang. Only 4 long-term care residents have received their second COVID shot. When do you expect those second shots will be delivered?
So I think, as I spoke to on Wednesday, many of the long-term care facilities will start to be able to deliver the second dose. Remember, we got to wait 21 to 28 days. I believe it's February 11th that we'll be able to start doing a large number of the residents with starting their second dose.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, in response to John's question, you said that these new restrictions will be in place for a month. We've typically been moving in 2-week phases, which I understand is based on COVID's incubation period. Why will it be a month before the next change is made?
So we're making a larger change. We're opening up a lot of gatherings, and we felt we needed to wait that 2 incubation periods to really get a good sense of how Nova Scotians are responding and what are we seeing in terms of our epidemiology resulting from increases in social activities in a number of ways.
Go ahead with your follow-up, Lindsay.
Thank you for that. And once again, for Dr. Strang, obviously with this weekend's leadership convention and your right-hand man there stepping aside for someone new, wondering what kind of COVID communications can Nova Scotians expect during this transition? Dr. Strang, will you continue to do these twice-weekly briefings?
So that's an ongoing conversation with the Premier and his staff. I've been reassured, there'll be certainly, we've recognized the importance of the Premier and myself being here regularly communicating to Nova Scotians, and that will continue, through the transition period and then with the new Premier.
There's a convention this weekend. That person will be chosen the leader of the party. I will remain the Premier until they are sworn in, and I want to reassure Nova Scotians that I have no intention of moving away from here until I can hand this seat to someone to support Dr. Strang. We've come too far together, and even though I may not be sitting in this chair, I will do whatever I can to support and work with Dr. Strang and the new leader to continue our province on the path we've been on for the last 11 months.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. Hopefully these numbers remain low, and this is just an academic question. But moving forward, do you think we can get some further delineation around close contacts in terms of whether they're in household or close contacts like out in the world in a business or so forth?
I mean, we always look at that about what's necessary to provide, and also while we're protecting people's privacy. But also, I know this come up before, Tim, from you and other folks. It's often we usually cannot be definitive, especially when there's local community exposures. We can't be definitive and say we know for sure that this is where they were exposed to COVID. They've often been in multiple places that could have been the source. So that's the other limitation, is we can only be definitive when we're absolutely able to be, and sometimes we can't be definitive to the level that you'd like because we have to protect people's privacy.
Go ahead with your follow-up, Tim.
Premier, on your venture capital announcements, we live in a capitalist economy and a patriarchy, and access to capital is a real issue, so I don't want to downplay that. But you cast it in terms of helping people get back to work after the pandemic or through the pandemic. And it's been suggested that the biggest obstacle for women in particular getting back into the workforce is affordable child care. So why not direct that money immediately to where it could do the most help right now instead of down the road?
So we've actually been applauded, Tim, for the way we dealt with childcare through this pandemic. We were the only government in this country to keep our childcare whole. We treated our childcare workers with the respect they deserve. We made sure those spaces were there, and we'll continue to do so. But the reality of it is we need to create economic opportunity for our daughters, our wives, our sisters in this province. And whether we like it or not, capital is not available the same way to our daughters as it is to our sons. And I think women in this province, in this region, have waited long enough. And I'm proud of the fact that not only is our government the first to invest in this, I'm hoping other governments do the same thing. But in no way should you think that by investing in the future of our wives and our sisters and our daughters that we haven't, that we forgot about our children. Quite frankly, we just finished up our pre-primary program, the largest social program in my lifetime in this province, to ensure that every child gets an opportunity to grow and build. But I'm really proud of the fact that I can support my daughter, your daughter, and other daughters in this province who have an idea and innovation to take that to the marketplace and create jobs right here at home.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. So, Dr. Strang, I'm wondering just if you could talk a little more about spectators being able to attend arts events, sports events, things like that, and that those are under the same end by 10 p.m., leave by 11 p.m. restrictions. For example, a play or a concert or something like that, whether they're serving food or alcohol or not?
Yeah, those will all be under the same restrictions. We are going to have to make an exception for a sport event that, just like hockey overtime, things that are out of control. You have to let that event, come to its natural end. Other things like plays, etc., they can figure out how long it is and adjust their start time. So, but in general, yes, the closure of 11 o'clock applies across the board. If the service of food and beverage is involved in any of those gatherings, that has to stop at 10 p.m.
Go ahead, Victoria, with your follow-up.
Thanks. And just some more on that, wondering still why that hour of 10 p.m. and 11 p.m. for everyone being out of the building. Why is that the magic hour still at this point? I know there was previously in the first wave we increased that. Do you think that was a big factor to cases bouncing up again? Is that why we haven't increased it again?
Oh, as I said in my remarks, it's part of keeping things slow and cautious. So we're opening up gatherings in lots of different ways. But what we know is the highest risk type of gathering is a social gathering, especially late at night when alcohol and other substances may be involved. We know over and over again those are the type of things that can create substantive super spreader events. So we're being cautious. We're opening up lots of other gatherings, but we're putting time and service limitations on that. We'll see where we end up in a month. But my hope is that we can start to extend that hour. But again, like we did as we reopened after the first wave, we opened it up sequentially with slow steps, adding an hour at a time. Always been careful about that.
Next, we'll go to Brooklyn Connolly from The Signal. Go ahead, Brooklyn.
Thank you. This question is for Dr. Strang. How will the province work with pharmacies to coordinate the vaccine rollout in prototype clinics that's set to begin in early March?
So I'm involved at a very high level. ADM Tracy Barbrick and her team are having ongoing extensive conversations with the Pharmacy Association. And they have submitted, we gave requirements of what would need to be met for pharmacy-type clinics. A proposal has been received back, and that's been reviewed. And so there's a lot of ongoing discussion, very productive and positive with the pharmacy sector through the Pharmacy Association on all the details of what pharmacy clinics would look like. And as you said, we hope to have our first few prototype clinics up and going, and in this first phase as supply allows.
Go ahead with your follow-up, Brooklyn.
Thank you. I'm also wondering if independently and locally owned pharmacies will be required to adhere to the same rollout guidelines as the province with regards to priority groups.
Absolutely. Those priority groups are not set by anybody who's going to be an immunizer, follows the provincially our direction on how we sequence the vaccine.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Good afternoon. Premier, in New Brunswick, Premier Higgs told our colleagues in Fredericton it could take until the end of 2021 for everyone in New Brunswick who wants a vaccine to get one. I'm just wondering, after the Premier spoke with the Prime Minister last night, are you or Nova Scotia reevaluating the timeline for vaccinating everyone?
No, we are continuing to do what we can control, which is the distribution network. I think I'm really proud of the way our government and public health have worked together to provide different formats of providing this vaccination. Colleague before just asked about pharmacy. That's looking at all of those and making sure that we test run a lot of these options. On the 22nd of this month, we'll have our first really public vaccination for people who are living in the community 80 plus to test drive it. The federal government obviously is concerned, as I think all of us are, about the vaccination coming in. But I don't think we should panic over that. They're working really hard. They've reassured us that we should get all of the doses we were supposed to get in the first quarter. And we'll make sure that our distribution system is set up to deliver that as quickly as possible. And then we should be back on track. And don't forget, there are a number of other vaccines that are in front of Health Canada now that if they get approved, we'll actually speed that up again. So, we're still on track, we believe, like everything. And I think Dr. Strang and I have demonstrated to Nova Scotians that if we have an issue, if there's something that as soon as we find out, we'll communicate that to Nova Scotians. But right now, we're going to continue on the path we are, where that if the vaccine when it arrives here, we'll put it in the arms of Nova Scotians. And if you get one shot, we want to guarantee you that you'll get your second one.
Go ahead, Shayna, with your follow-up.
Thank you. My second question is for Dr. Strang. Just following up on what Victoria asked about opening hours. A lot of focus on that sector at bars and restaurants during the second wave, and you mentioned specifically the evidence about alcohol. At this point, if that industry is trying to plan for things like staffing and supplies and so on, is it reasonable for them to conclude what we've got now, or at least the way things are going to stay for a couple of months?
Well, we've given them a month of certainty around in terms of, as much as we can. Always we're in ongoing conversations with the restaurant and licensed establishment sector. They fully understand that if our epidemiology starts to take a sideways turn, that we will have to respond. But we're loosening the restrictions in other ways. Clarified for them that the current hours will last for another month if at all we're able to, and then we're hope to be able to go beyond that. But again, we've heard over and over again, especially from the restaurant sector, is that what hurts them the most is opening up, investing in food and bringing staff back, and then being closed down again. So we're trying to, again, for like other businesses, but especially the restaurants, it really hurts them, this yo-yoing back and forth. So our goal is to open things up and keep them open if at all possible.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Today we've opened up a little bit. I want to please don't abuse this ability to gather. COVID is still here, and we need to remain vigilant and follow all of the public health protocols. Dr. Strang, this is our 96th briefing since we started this journey 11 months ago. I want to thank you for your support, your guidance, and most of all, your friendship as we found our way through this. As been mentioned a couple of times, the Liberal Party will be choosing a new leader this Saturday. I will work in a transition to ensure that that new leader fully has the capacity to move through and to deal with COVID and other things. But until the new leader is sworn in, I will still be the Premier of this province and working alongside Dr. Strang. So I want all of you to have a healthy and safe weekend, and I look forward to seeing you next week with Dr. Strang.